So next topic is tissue sensitivity. First we'll start with the cell cycle. There are some phases in the cell cycle, C1, C2, and what is left? S phase, M phase. So this G2M phase, G2M is phase, most sensitive phase of the cell cycle. And this S phase, this is most radio resistant. So G2M interface is the most sensitive, and this S phase is the most radio resistant. Number two, we'll see cells and tissues, or you can say organ. Most radio sensitive and most radio resistant cell, that is lymphocyte. That is lymphocyte. Because lymphocyte carries so much big nucleus that may cover the whole of the cell. So this is the most sensitive cell, lymphocyte. Most sensitive tissue is the bone marrow. If bone marrow is not given in your MCQ, it is not given in option, then your answer will be collapse. Answer will be collapse. Most radio resistant cell is RBC. If RBC is not given, answer will be platelet. Both do not have nucleus. RBC and platelet both do not have nucleus. Both are radio resistant. But in the books they have given RBC is more radio resistant than platelet. So if it is not given in option, answer will be platelet. If we compare tissue, CNS, that is the brain is the most radio resistant tissue. This is the brain. So these are the cells, tissue. Next is tumors. Next is there are some tumors which respond to our radiotherapy. We call them most radio sensitive tumor and most radio resistant tumor. So the most important example or MCQ is Hodgkin lymphoma. Hodgkin lymphoma is the most radio sensitive tumor. And second is, number two is Ewing sarcoma. Ewing sarcoma. So these are the two tumors, they will respond to radiation therapy. And what is the single most radio resistant tumor? That is the melanoma. Yes, this is melanoma. One is renal cell carcinoma. So two tumor which are more sensitive, they will respond to your therapy: Hodgkin lymphoma, Ewing sarcoma. And radio resistant, not they are so resistant they will not respond: melanoma and renal cell carcinoma. So they are responding to radiation. With this tumor, if you remember, there is one tumor which respond to chemotherapy very well. They respond to chemotherapy. That is your canine TVT. We give vincristine. So there are some tumor, they respond well to chemotherapy. Some tumor respond to radiotherapy and some are resistant. So these are the MCQs, out of which this lymphocyte, it was asked in ICAR 2016, 2017, 2018, three times, that Most sensitive blood cell. Most sensitive blood cell. Answer was lymphocyte. Why it is most sensitive? Because it is having the biggest nucleus in it. So these are overall most sensitive and most resistant cells, tissues and tumors. Now we'll see system wise in which cell is more sensitive and which cell is more resistant. For example, if we start with lymphoid tissues. So what are lymphoid tissues? Lymph node, spleen and thymus. In these three organs, the most radiosensitive is, again the answer is same, lymphocyte. Yes. Number two, if we go to bone marrow, if we go to bone marrow, we have some precursors. We have precursors of RBC, WBC and platelet. Out of these precursor of this RBC, we call them erythroblast. They are more radiosensitive. These are. Next organ, if we see, that is your cardiovascular system. Although cardiovascular system CNS they are resistant, but in CVS we have heart, we have arteries, we have veins, and we have capillaries. Out of these structures, capillaries, yes, they are more radiosensitive because they have only endothelium. They are more sensitive. Next, if we take any organ, from GIT, from GIT, we have stomach, small intestine, and we have large intestine. Out of these three, this small intestine having duodenum, jejunum, ileum. Out of these three, this duodenum is most sensitive. Duodenum is most sensitive. Next organ, reproductive system. Reproductive system. Sperm are resistant. They are resistant. Ova, they are sensitive. They are sensitive. And if we look at the pathway of spermatogenesis, then spermatocytes are most sensitive. They are more sensitive than spermatogonia. This is written in your gynecology Robert book that spermatocytes are the most sensitive. Then reproductive over. Okay. Then one more is Leydig cell, Sertoli cell. Leydig cell are more resistant than even than Sertoli. So most resistant are the Leydig cell. Sertoli cell are also resistant, but Leydig cell are most resistant. Spermatocyte most sensitive one. So these are some system-wise sensitivity.